The report is about people with different background cultures and discrimination, and better for people with a learning disability.
They need to see the person first, not the disability or race, and work with the person to how best to support them.
Some disabilities you can see, and some of them they're hidden. So I've always said, just don't assume that the person's is fine. Just go up and ask. We're human beings and we have feelings as well. Sometimes doctors talk to the carers instead of the patient. It's just not nice to see. So for me, I would like to see people just treated better across the spectrum.
The main things for me in the report were racism and intersectionality as well. So intersectionality means that you're at a disadvantage on many fronts. For example, you're disabled and you're from a black minority ethnic community. People are dying, and many people don't like to talk about death. But we need to talk about death to stop people dying unnecessarily as well.
We need to treat people individually. We cannot just generalize.
So looking at the ethnic lens as well, it's really, really important to understand the individual from their cultural, religious backgrounds as well. We have many, within our services, and to then tailor-make a service that's relevant for them would make a big difference to the quality of life for that particular individual and their family.
There are lots of policies that the government has put in place to try and improve care, and many of those policies are directly related to people with learning disability. But what we don't have is clear guidance around those policies that say, well, within that group, you need to pay specific attention to people from ethnic minority background. And that's really missing in many of the reports. And clearly, it would be helpful to try and look at how we can try and improve that, because there is a disparity, there is an inequality, and the only way we can try and address that is to have a policy at a central level that can be put across in a way that others can understand.
Once the final paper is published and it gets taken forward, I'd hope that real strategic change happens, and that number one, that everybody that has a learning disability, or the majority of those with a learning disability, that is put on their records to make sure that they get all the things that they need, like annual health checks. I'd hope that there are inroads into the various different communities whereby people have already acknowledged that these people are not getting the right sort of healthcare, so that we make a balance in these inequalities.
It's important that we check our learning disability register and ensure that everyone who should be there is there. And it's a significant one because it triggers various things, not only the health check, but how we communicate about that health check. Sending easy read information, for example, is triggered by the fact that people are on that learning disability register. So if we can do something about improving in that.
Let's start to live this differently. Let's start to have people in valued and important roles in our organisations, and let's change what we do. We can all shift the power balance and shift what we do and learn from each other by acting differently.
We also need to improve understanding in the community themselves. So, for example, we need all family members and communities as a whole to understand that there is support available for Black, Asian and minority ethnic people with a learning disability, and that support can be really productive in helping them achieve their life goals. So let's get better at that. But we also need to ensure that those voluntary organisations that work with people with a learning disability are open to all and are accessible to all as well, so that they can do the advocacy work, the support work, so that Black, Asian and minority ethnic people with a learning disability can also benefit from the support that they provide.
And we really need to make sure that policies are representing people with a learning disability from ethnic minorities, and we really need to be making sure that research hears the voices of people from ethnic minorities with a learning disability.
And it needs to be auctioned. It's not worth it if people listen and they don't act on it. Most importantly, empathy is needed, passion is needed. You don't even know the background of exactly.
I think for me, co-production, co-design is key to making that happen. So for me, when you start off on a blank page, you need to understand the recipient of your service. You need to engage and involve those individuals.
I feel like we're going to get our voices heard, and yeah, we felt listened to. The whole health system should just change. I feel like if there was like a learning disability nurse in every hospital, I think it would help.
I think we need to do more and improve more. I think we need to work with health and social care to make it really happen for people.